In this video, we're talking about choking and what to do if your child chokes. Now, gagging is normal. When you introduce solids to your little one, they need to learn how to actually eat. Their tongue pushes the food forward, and often what you'll see them do is that they will turn red, they will start coughing, they'll vomit up whatever they're eating and then just keep eating it. It's a little bit gross, but it's completely normal. Gagging is fine. Choking isn't. Choking is when something is stuck in the esophagus or the airway, and we usually need to help them get it out. Now, choking can be broken up into 3 sections. If they are unconscious, you are going through DRSABC. If they have what we call an effective cough, where they can take a big breath in and a big cough out, that's the body's natural way of trying to pop out whatever object is in there. So, if, when we look at them, if your child was having a strong effective cough but something was lodged there, look in their mouth. If you can easily get that out, absolutely do it. If you can easily see that piece of Lego or whatever it is that's in there and you can get it out, help them get it out. But if it's right at the back, don't risk sticking your fingers right in there and pushing it down. You're going to have to leave it in there. If they have this strong effective cough and we went to whack them on the back while they're having this, there's a danger of, while they're taking that big breath in, we could potentially dislodge that object and they could breathe it further down, possibly blocking off their airway. So, if someone has a strong, effective cough, we need to simply encourage them to keep coughing. Hold them, lean them forward. Good girl, Annie, keep coughing. Keep coughing, Annie, and watch them very carefully. What usually happens, they'll have some strong coughs, they'll end up vomiting out whatever is in there, and then they'll be fine. However, if they have what we call an ineffective cough, so it's either that's not a lung full of air to actually force that object out, or if they have what we call, being silent, so there's no air going in or out, literally just, then we need to intervene quickly. Get them out of the high chair or whatever it is that they're sitting in. Put them over your leg. Your leg is just to stabilise them so that we don't drop them on their head, because that is a whole other set of problems that we don't need to deal with. And between the shoulder blades, we're going to give them what we call back blows. Get gravity to help you, preferably their bottom higher than their head. Between the shoulder blades with the heel of our hand, we're going to give back blows. 1, 2, 3, 4, 5. Now obviously, if the object comes out after the first back blow, we're not going to do all 5. However, if the back blows aren't working, we're going to turn the child over, and hopefully that movement will also help to dislodge the object. Between the nipple line, same place as what we do CPR, just below the nipple line, on the hard sternum or breastbone, we're going to do chest thrusts. So we can do up to 5 of these. 1, 2, 3, 4, 5. If that doesn't work, back over again into your back blows. 5, 5, 5, 5, until either the object comes out or they become unconscious. If they become unconscious, we're going through DRSABC. If the object doesn't come out after 5 back blows, call an ambulance. You need medical help. The most common things that we see children choke on, a lot of it is when a mobile child will stick something in their mouth and run or crawl and stumble and down it goes. Or a lot of the things we see, grapes. Chop grapes up into quarters, cherry tomatoes, sausages. Chop things up, and of course you're watching your young children while they eat. And it's often a good idea to get them to sit down on their bottoms while they eat. It's a hard thing to get a toddler to do, but it's important when it comes to choking. If it is an older child who's choking that you can't put down over your leg, then what you need to do is lean them forward. You can quickly look in their mouth. If you can get that object out, get it out. But if you can't, use your leg to stabilise them, lean them forward, firm, direct back blows between the shoulder blades. Remember, it's not a whack down, it's a firm hit. 5 back blows. If that doesn't work, then lay them on the floor and do 5 chest thrusts. Hopefully that getting up and getting down will help to dislodge whatever the object is. 5 back blows, 5 chest thrusts, 5, 5, 5, 5, until the object either comes out or they become unconscious, and then you are going through doctor's ABC.